How do paramedics use the Glasgow Coma scale? Imagine arriving at the scene of a serious accident where a person is unresponsive. Paramedics need to quickly assess the severity of the injury and determine the best course of action. One of the most vital tools they relying on is the Glasgow Coma scale. This scale provides a standardized way to evaluate a patient's level of consciousness based on specific responses. The Glasgow Coma scale is composed of three main components: eye-opening, verbal response, and motor response. Each component has a set of scoring criteria that range from normal to severely impaired. For eye-opening, the scores go from no eye-opening at all to spontaneous eye-opening without any stimulation. Verbal response is assessed by observing whether the patient is oriented and able to speak coherently, confused, or completely unresponsive. Motor response involves checking if the patient obeys commands, localizes pain, withdraws from pain, or shows abnormal posturing. Paramedics use this scale during their initial assessment to gather objective information about the patient's neurological status. They observe the patient's eye movements by gently stimulating the eyes and noting whether they open spontaneously, in response to voice, or only to pain. For verbal response, they try to communicate with the patient, noting if they are alert, confused, or unresponsive. Motor responses are tested by applying a controlled painful stimulus, such as pressing on the nail bed or applying pressure to the trapezius muscle, and observing how the patient reacts. The scores from each category are added together to produce a total score ranging from 3 to 15. A higher score indicates a better level of consciousness, while a lower score suggests a more severe impairment. Paramedics use this total score to determine the urgency of medical intervention, prioritize transport, and communicate the patient's condition to hospital staff. The Glasgow Coma scale is a crucial component of prehospital care because it provides a quick, reliable, and standardized way to assess neurological function. It helps paramedics make informed decisions in critical moments, ensuring that patients receive the appropriate level of care as swiftly as possible.